Hello everyone and welcome back to EverlastCyber. In today's video, we'll be going through the part 3 portion of the NACC PSW practice questions and answers. We'll be starting right off with question 1. Your client has hirsutism. What do they have? A. Hair loss. B. Excessive and increased hair growth. C. Excessive amount of dry white flakes. D. Razor bumps. In option A, hair loss is known as alopecia, so this wouldn't be our answer. For option B, hirsutism is a condition in which a person, especially a woman, or rather usually a woman, has excessive coarse dark hair growth in areas where men typically grow hair, like the chest, the face, and the back. This is usually due to hormonal imbalances and they are often related to excess androgens. In option C, excessive dry white flakes is known as dandruff. And in option D, razor bumps is known as pseudofolliculitis barbae. So, based on the options we have, the correct answer is option B. Hirsutism is excessive and increased hair growth that usually occurs in a woman where she has excessive coarse dark hair growth in areas where men typically grow hair, like the face, the chest, and the back. Question 2. Pneumonia is the dash leading cause of death in Canada. A. Second. B. Third. C. Eighth. D. Fourth. We'll be going with option C here. According to the latest data from Statistics Canada, influenza and pneumonia are ranked as the eighth leading cause of death in Canada in 2022 and 2023. Now, since pneumonia is grouped with influenza in these statistics, it holds the eighth position in the rankings. Question 3. While you're helping a client by putting lotion on their skin, they ask you to apply Voltaren cream to their knees to help with arthritis pain. What should you not do? A. Apply the Voltaren cream for the client to help relieve their knee pain. B. Politely explain that applying medicated cream is beyond your role as a support worker. C. Inform your supervisor or nurse about the client's request. D. Both B and C. As a PSW, you should not be applying Voltaren cream because it is a medication. It is not just a lotion. Applying medication is not within a support worker's duties unless it is specifically delegated and documented. What you should be doing is to explain this to the client and also notify your supervisor or the nurse. So, based on the options, what you shouldn't be doing is option A, applying the cream for the clients in order to relieve their knee pain. You should not be doing that as a support worker. Question 4. Your client's spouse states that he suspects his wife was given expired insulin, but he does not want to make waves. What do you do? A. Call the supervisor and report. B. Tell his nurse that she should be more careful next time. C. Ask the spouse what other mistakes the nurse makes. D. Tell him that the insulin is okay since when you eat expired food, you are fine. Now, let's take a look at these options. If a client's family member expresses a concern about possible medication error or expired medication, you must treat it seriously and follow the chain of command. So, what you should do is to immediately report the concern to your supervisor or the nurse in charge. It is never appropriate to ignore the concern. You can reassure the family, but ensure that you always check. Also, it is not appropriate to blame the nurse or gossip about other mistakes. Option B is inappropriate. Telling a nurse to be more careful is not your role. In option C, this would encourage gossip and it undermines professional conduct, so you shouldn't be doing that. And option D is unsafe and dismissive. Expired medication can be harmful. So, what you should do is option A, call the supervisor and report. You should never take their concern for granted. Question 5. What does RUQ stand for? A. Rest under care. B. Right upper quadrant. C. Right under quadrant. D. Left upper quadrant. For this, we'll be going with option B. RUQ stands for the right upper quadrant, and this is a medical term that is used to describe one of the four sections of the abdomen. It is usually used when assessing abdominal pain or organ location. So, the right upper quadrant consists of parts of the liver, gallbladder, right kidney, and parts of the intestines. Question 6. Which is an example of assisting with medication in the PSW scope of practice? A. Reminding the clients to take a medication. B. Reading the prescription label to the clients. C. Providing water or other fluids as needed. D. All of the above. Within a personal support worker or support worker's scope of practice, assisting with medication does not mean you're administering the medication or deciding dosages. It means that you're supporting the client in safe, self directed medication use. So, examples of assisting would include reminding the clients to take their medication at the scheduled time, reading the prescription label if the client can see or read it carefully, and also providing water or other fluids in order to help the client swallow the medication. So, our answer here would be option D. It is all of the above. All the actions are considered assisting, but not administering. So, they are within the PSW rule if it is allowed by the care plan. Question 7. Before giving medication, the nurse needs to identify the client. How should they do this? A. Follow the employer's policy. B. Check the client's full name. C. Check if the label on the back of the client's clothing has the client's name on it. D. Both A and C. Before giving any medication, nurses must follow their facilities or the client's identification policy. And this usually means using two approved identifiers, which would be first, asking the client to state their full name and date of birth, and also checking the ID band or medical record. They can also verify the medication order against the client's chart. In option B, checking the client's full name alone is good practice, but on its own, it does not meet the standard. If the employer's policy requires two identifiers, you have to use two identifiers to identify the client. Option C, checking the label on the back of clothing is not reliable or safe practice for patient identification, because what if they are wearing someone else's piece of clothing? So the best option would be option A. Ensure that you follow the employer's policy, because the employer would have put certain things in place to ensure that you're able to properly identify the clients. Question 8. In your workplace, full-time workers have benefits covering alternative therapies. You know that alternative therapies are not conventional medicine, and they include A. Hydrotherapy. B. Herbal products like ginseng. C. Body work like massage. D. All of the above. Alternative therapies refers to health practices that falls outside of conventional Western medicine. They include a variety of approaches like hydrotherapy, which is using water for pain relief and treatments, herbal products like ginseng, which is using a plant-based remedy to promote wellness, as well as body work, like the massage, manual therapies to relieve tension, improve circulation, and support healing. So all of these that have been mentioned are not conventional medicine. They are alternative therapies. Question 9. What is anaphylaxis? A. A severe allergic reaction. B. It can manifest through difficulty in breathing because of swelling in the airway. C. It is a medical emergency, so you need to call the nurse or 911 if you suspect it. D. All of the above. Anaphylaxis is a severe life-threatening allergic reaction, and it could be to things like food, medication, latex, or even insect stings. It can cause swelling of the airway, leading to difficulty in breathing or choking. And this is a very serious medical emergency. So you must call the nurse immediately or dial 911 because rapid treatment with epinephrine is often needed to save that person's life. So anaphylaxis is all of the above, all these things that we've mentioned. That is what anaphylaxis entails. Question 10. A client has been ordered sublingual tablets. What should the nurse do? A. Ask the client to put the tablet against her cheek, giving the medication with a glass of water. Ask the client to place it under her tongue. Ask the client how she would like to take it. For this, we'll be going with option C. Sublingual means under the tongue. This route allows the medication to dissolve and be quickly absorbed through the tissues under the tongue, thereby bypassing the digestive system. Putting it against the cheek is called buccal, not sublingual. Giving a glass of water with the medication is incorrect because you don't swallow a sublingual tablet. Water may wash it down and make it ineffective. So the correct method is placing it under the tongue as ordered and not by asking the client how they would like to take it. Question 11. If a medication has severe effects on the client's body, what are these effects called? A. Adverse effects. B. Side effects. C. Severe side effects. D. Life-threatening side effects. For this, we'll be going with option A. Adverse effects are unexpected, harmful, and severe reactions to a medication. They are undesirable and potentially dangerous, and they go beyond common or mild side effects. So, these are what adverse effects are. For medications that have severe effects on a client's body, they are really unexpected and harmful, and it causes severe reactions to the medication. Question 12. Normal flora are A. Harmless and beneficial to the body. B. Made up of the microbes that naturally live and grow in certain locations in the human body. C. Found on the skin and in the respiratory tract and digestive tract. D. All of the above. For this, we'll be going with option D. Normal flora are microorganisms such as bacteria or fungi that naturally lives in and on the human body. They are generally harmless and they are often beneficial because they help with processes like digestion, and they also protect against harmful microbes. They can be found on the skin, in the digestive tract, in the urinary tract, and other parts of the body. Question 13. A nurse needs to give the right dosage of medication. You know that A. Exceeding the dose can be dangerous to the client. B. The dose is listed on the label of the medication container and on the MAR. C. The dose is the amount of medication prescribed to the client. D. All of the above. Looking at all these statements are true about medication dose. So our answer is option D. Giving more than the prescribed dose can be dangerous or even life-threatening for the client. The correct dose is always listed on the medication label or the medication administration record, which the nurse must check before administering that medication. Also, the dose simply means the exact amount of medication that has been prescribed for that client to take. Question 14. You overhear your client asking his son to buy him ginseng. You know, A, ginseng is not prescribed by the client's doctor, so he should not take it. B, ginseng might interact with the client's medication, and the healthcare team should be notified the client takes this supplement. C, ginseng is not medication, so it is not the concern of the health team. D, you should not worry about it since you do not give medication. Looking at the options, option A is too strict. The client has the right to take non-prescriptive products, but the team must be aware. Option B is likely our answer because ginseng is a herbal supplement and not a prescription medication. So it can interact with prescribed drugs. It can also affect blood sugar, blood pressure, as well as other body systems. Even though it is natural, it can cause side effects or interfere with treatments. Option C is incorrect. All supplements should be monitored. And option D is unsafe because it is your responsibility to report anything that could affect the client's care. So in this case, our answer is option B. Question 15. What is a sterile field? A work area free of microbes, both pathogens and non-pathogens. B, a park without trees. C, the process of removing dead skin cells. D, the environment in which microbes live and grow. A sterile field is an area that is free of all forms of microorganisms in order to prevent infection, and this is usually during medical procedures. So our answer here is option A. A park with no trees is unrelated to the concept of a sterile field. The process of removing dead skin cells is called exfoliation, and that is a skincare process. It is not related to sterility. In option D, the environment in which microbes live and grow is called a microbial habitat, and that is the opposite of a sterile field. So we know that our answer here is option A. Question 16. Signs of aspiration includes A. Change in breathing from difficulty to normal, noisy or rapid, and shallow. B. Pink lips. C. Coughing or choking during feeding. D. All of the above. Option A, if you look at it, is partially confusing because aspiration causes breathing difficulties like noisy or rapid shallow breathing. But where they mention change from difficulty to normal, it doesn't make sense as a sign of aspiration. In option B, pink lips indicates good oxygenation and it is not a sign of aspiration. Aspiration sign will show a pale or bluish lips, which indicates oxygen deprivation. Option C is the classic or most common sign of aspiration because food or liquid enters the airway instead of the stomach, so it will cause coughing or choking during feeding. Option D would not be correct because A and B are already incorrect. So our answer here is option C, coughing or choking during feeding. Question 17. What is the most important nutrient necessary for life? A, water. B, protein. C, carbohydrates. D, fats. We'll be going with option A here. Water is essential for all life processes. It makes up a large part of the human body and it is crucial for regulating temperature, lubricating joints, transporting nutrients and waste, as well as facilitating many biochemical reactions. Proteins, carbohydrates, and fats are important, but they are macronutrients that provide energy and building blocks for the body. but without water, life cannot be sustained, even for a short period of time. Question 18. Physicians order IV therapy for the following reasons except A. To reverse hydration in the body, B. To provide required fluids when the client is NPO, C. To replace minerals and vitamins lost due to injury or illness, D. To provide sugar for energy. Remember, the question says physicians order the IV therapy for all these reasons except. So, looking at option A, this would be incorrect because IV therapy is used to provide fluids and hydration, not to reverse it. Reversing hydration means causing dehydration, and that is the opposite of what we're trying to accomplish here. So that would be our answer. The other options, option B, to provide clients the required fluids when the client is NPO. NPO means nothing by mouth. It is a common reason for IV therapy in order to maintain hydration and nutrition. In option C, IV therapy can deliver electrolytes, minerals, and vitamins directly. And in option D, IV solutions often contain glucose to supply energy when oral intake is not possible. So our answer here is option A. This is not a reason why IV therapy is ordered. Question 19. What products must never be mixed? A. Ammonia and baking soda. B. Chlorine, bleach, and baking soda. C. Bleach and baking soda. D. Ammonia and chlorine bleach. For this, we'll be going with option A. Mixing ammonia and chlorine bleach produces toxic chloramine gases, which are very dangerous to breathe and can cause serious respiratory problems. The other combinations don't produce such harmful gases and they are generally not as hazardous, although mixing any chemicals without knowledge is not recommended. Question 20. A container called a dash is used to measure fluids, including leftover fluids, vomit, urine, and drainage from suction. A. Syringe. B. Graduates. C. Measuring cup. D. Measuring cap. A syringe is used for injecting or withdrawing fluids. It is not used for measuring larger volumes. A graduate is a specially designated container marked with measurements used to accurately measure fluids like leftover fluids, urine, or drainage from suction. A measuring cup is usually used in kitchens, not in clinical settings, and a measuring cap is used for small amounts of liquid medicine. So our answer here is option B, a graduate. Question 21. Trendelenburg position is when the head of the bed is dash and the foot of the bed is dash. A. Lowered and raised. B. Raised and lowered. C. Lowered and lowered. D. None of the above. For this, we'll be going with option A. In the Trendelenburg position, the head of the bed is lowered and the foot of the bed is raised. This position is usually used to improve blood flow to the brain or for certain surgical procedures. Question 22. What is nutrition? A. The processes involved in the digestion, ingestion, absorption, and the use of foods and fluids by the body. B. The processes involved in the inhalation of fluid or an object into the lungs. C. The processes involved in taking food and fluids into the body. D. The process by which substances pass through the intestinal wall into the blood. Our answer is option A. In option B, this describes aspiration, where liquid or fluid is where fluid or objects are inhaled into the lungs. Option C covers ingestion, but it doesn't cover the full process of nutrition, while option D describes absorption only, which is just one part of nutrition. So option A best describes what nutrition is. It is the ingestion, digestion, absorption, and use of foods and fluids by the body. Question 23. Cleaning guidelines include all of the following except A. Work from dry to wet. B. Change cleaning cloth and water frequently. C. Work from dirtiest to cleanest. D. Work from higher to lower. For this, we'll be going with option C. Cleaning guidelines recommends working from the cleanest to the dirtiest areas in order to prevent spreading dirt and contaminants. Question 24. What does PICC stand for? A. Peripheric inferior central catheters. B. Peripherally inverted central catheters. C. Peripheral internal central catheters. D. Peripherally inserted central catheters. For this, the answer is option D. A PICC line is a type of long, thin catheter inserted into a peripheral vein, usually in the arm, and advanced until the tip reaches a large central vein near the heart. This is used for long-term intravenous access. Question 25. 1 gram of fat supplies the body with dash calories. A. 2. B. 4. C. 5. D. 9. Our answer here is option D. Each gram of fat provides 9 calories of energy. That brings us to the end of the part 3 practice questions and answers for the NACC PSW exam. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next video.